Good morning, Unical community, our listeners far and wide, Malabite and Malaverses, and our darling listeners. You are tuned into Unical 103.5 FM, and this is our World Health Day 2025. The theme for this year World Health Day is Healthy Beginnings, Hopeful Futures, a call to action to prioritize the health and well-being of women and children across the communities. And you know how we do it right here on Unical 103.5 FM, the only radio station that offers you information, education, and of course, entertainment 360. Well, we are bringing to you today's World Health Special right here on the radio, and I have a very important personality with me right here in the studio, but I'm not going to let the cat out of the bag. We're just going to go on a very short break, and I'm going to leave you with something from Asha, my very own favorite. I will be leaving you with The Beginning, since this year's theme is Healthy Beginnings. Okay, if you've just tuned in, this is Unical 103.5 FM, the only radio station that offers you information, education, and of course, entertainment 360. My name is Ake Onwada. They call me the Radio Lolo. Today, we are having something very special today in the studio. We are celebrating World Health Day 2025, Team Healthy Beginnings and Hopeful Futures. Right here on the studio, I'm having no other person than a delectable young lady who have crossed and pushed all borders in education. I have no other person than Dr. Praise Andrew, member West African College of Surgeons, senior resident doctor, Department of Obstetrics and Gynaecology, UCTH Calabar. Ladies and gentlemen, Dr. Praise.
Good morning, everyone. Thank you for having me today.
Good morning, Dr. Praise. Yeah. You sound so cool and so. How are you feeling this morning?
Fine, thank you.
Thank you for honoring our invitation. Thank you. So far so good. How long have you been in this obstetrics and gynecology?
Oh, thank you very much. So I've been a resident doctor in obstetrics and gynecology for about 7 years now. Yeah.
So let's begin with a broad view. What are the major maternal health challenges women in Nigeria face today, especially in undeserved communities?
Thank you very much. Women in Nigeria, especially in underserved communities, they face a lot of maternal and child health issues.
Okay.
And topmost among those issues are limited access to health facilities and infrastructure. We have a dearth of health facilities. They have poor access to some of these facilities, poor transportation system to help them run when there are emergencies. We also have the issue of poor education. Women still don't know how to take care of themselves when they are pregnant, and this has led to a lot of mortality. Nigeria still has a very high mortality rate of about 576 per 100,000 women, and that's quite high because the WHO aims to reduce mortality to less than 70 per 100,000 live births, and we are at 576. Wonderful. So that's really crazy. A lot of women are dying, and this shouldn't happen. And so these are some of the challenges we face, with hypertensive disorders in pregnancy being one of the major causes of death in women in pregnancy now. Also, we have the issue of understaffed facilities with the so-called JAPA syndrome. A lot of doctors and health workers have left the country, and so we have limited medical personnel still available to help the millions of Nigerians. And so these are some of the problems we have facing mothers and children in Nigeria, especially in the undeserved and underserved communities.
Wonderful. That was a very wonderful statistics you gave there. So this year World Health Day is themed Healthy Beginnings, Hopeful Future. What does this mean to you in the context of maternal and newborn care?
Thank you very much. So healthy beginnings and hopeful future in regards to maternal and newborn care. We hope for a world where women shouldn't die in pregnancy, and children, especially newborn and under 5 children, shouldn't die in their infancy. And so this is to bring about advocacy, to bring about a reduction in the statistics that I've mentioned earlier. Yes, and so that's what it means for us, that healthy beginnings, we have women staying alive, giving birth to children, and that's marking a beginning in their families. And then these children also stay alive and don't die in their infancy and child age. And so that's what, in regards to maternal and child health, the WHO, World Health Day, Healthy Beginnings, Hopeful Future. We want to have a hopeful future where women stay alive.
Yeah.
They are armed with the right information to make proper choices and decisions regarding their health, and therefore they stay alive to have these healthy beginnings, and then we have a hopeful future where we have a reduction in maternal mortality.
Splendid.
Thank you.
That was just splendid. So, how can teaching hospitals and academic institutions like Unical and UCTH play a transformative role in maternal healthcare policy and delivery?
Thank you very much. So, a teaching hospital is a tertiary health facility, and a university is an educational environment. And so, how they can contribute to help in maternal and child health is by ensuring we have continuing health education for the existing workers. We have the health workers, nurses, doctors, and then even the upcoming ones, the younger ones, the medical students, nursing students, and other health practitioners. They have the proper education so that they can come up and do their bit to help to save mothers and children in particular. And collaboration with interprofessional departments. We have joint sections, more awareness, more training of staff, collaboration with investment facilities to invest in maternal and child health. This will go a long way to improve maternal and child health. Yeah.
Wonderful, splendid. Right here in Unical 103.5 FM, you've heard Dr. Precious giving her statistics on what World Health has given for this year World Health Day. She has given her pep talk and TED talk on collaborations with university and the community at large. So we're going to go on a very short break, and I'm going to play you something from Asa. Again, like I said, Asa is my favorite. I'll be leaving you with Peace by Asa. Don't touch that dial. This is Unical 103.5 FM. 15 minutes past the hour of 10. If you have just tuned in, this is Unical 103.5 FM, the only radio station that offers you information, education, and of course, entertainment 360. Today on the educational sector, we are celebrating World Health Day 2025, themed Healthy Beginnings, Hopeful Future. Right here in the studio, we have Dr. Praise Andrew, a senior surgeon from the University Teaching Hospital. Miss Praise.
Yeah, thank you.
It is such an honor to have you in the studio. Thank you. So, well, we're just discussing about the statistics that World Health gave about child mortality and mother's health. And we're also talking about the Japa syndrome in the medical sector of our country. And yeah, Dr. Praise was actually like giving us tips and head-to-head asking our questions about everything we're asking about World Health Day. So we are moving forward. Why is preventive care so critical in reducing complications during pregnancy and childbirth?
Thank you very much. So, like they say, prevention is better than cure.
Okay.
And this applies also in reducing mortality in maternal and child health. Preventive measures are very important, and this could help to identify women who are already having pre-existing health conditions before pregnancy. Some women may not even know they have hypertension or diabetes before pregnancy, but when they employ these preventive measures, this can be picked, and then they can be effectively managed to prevent complications that could lead to death in them or the baby. And then even within the pregnancy, preventive measures entail identifying these women. Some women develop problems within pregnancy. A woman can be normal all through pregnancy and then develop what we call pregnancy-induced hypertension, preeclampsia. And like I told you earlier, this is the major thing killing women now in pregnancy, hypertensive disorders in pregnancy. Some women develop it within pregnancy. And so if they are not taking preventive measures like going for antenatal care, these will not be identified. And by the time they are picking it up, they are almost dying. They're already in the bad stage, and so that's why prevention is very important. There are medications we give pregnant women. If they don't come to the antenatal clinic per se, they won't get these medications, and some of these medications are to help prevent even complications in the baby.
Yeah,
you understand. And when they don't take these medications, when they don't take these preventive measures, they end up having complications in the baby or in their own lives. And that's why preventive measures are very important. They go a long way to reduce maternal mortality and even infant mortality and morbidity.
Well, you have heard it from herself. Dr. Praise Andrew have said it. Pregnant women should always go for antenatal. They should always keep up with their medications. They should always go for monthly checkup, because even after the whole trimester, when they are close to the end, and the complications just come up on its own. So how is digital technology like mobile health and telemedicine helping to improve maternal health, and what's its potential for scale in Nigeria?
All right, thank you very much. Like I said earlier, we already have a dearth of medical personnel in the country, a lot of people leaving, and so we have few medical practitioners to attend to the millions of Nigerians. And then we even have people in rural areas where sometimes they don't even have a medical practitioner there to help them, and that's where telemedicine comes in, where people can have access to skilled health professionals over the phone, and they can listen to their complaints, and then they can provide basic solutions that can be found within their environment, and can also give them that information they need to say, okay, this is beyond your environment, you need to move to the next health facility for emergency care. And that's the role telemedicine comes in. Also, telemedicine is important to gather data on what's going on, because I gave you statistics of 576 per 100,000 live births, and that can't be possible without telemedicine, where we can get this data and then we can feed it into the appropriate channels where it can help to influence policies that could help to significantly improve maternal child health. So that's how telemedicine can really come a long way to help in helping our women and their children.
Okay, digital technology helped to accumulate the data of 576 per 100,000, which the World Health now holds up for a community like the communities in Nigeria. Maternal health doesn't stop at childbirth. What should our systems be doing to support mothers' long-term health and well-being post-delivery?
Thank you very much. So post-delivery, mothers still need to be supported mentally, physically, emotionally. And so this goes a long way to help ensure especially new mothers, they enter into motherhood on a soft landing. And it's important that even our primary health facilities should be aware of postpartum health care, and that will help so that women who cannot go to these big health facilities can also access care in their primary health centers. It's important. There are some women, like this hypertensive disorders in pregnancy I told you about, some women develop it after childbirth. And so if they don't go for checkup, they don't recognize the symptoms, the signs, they could. I heard about a woman who just delivered and just slumped in the house and died just like that.
So even after the first
trimesters, even after all the trimesters following delivery, they still need to be checked, because they could still develop some complications. Some bleed a lot during delivery, and they have to be checked postpartum to ensure that they recover optimally after delivery. So some women go through a traumatic birth experience and may depression and all that, and it's something that is not really talked about. And so it's very important that women are supported, especially with even mental health awareness and seeking for help when there are issues. And that will go a long way beyond the delivery process to ensure that women are stabilized to be able to care for their newborn and also their families.
Wonderful. Well answered. Thank you very much, Dr. Praise.
Thank you.
Well, finally, on this World Health Day, what message would you like to share with health workers, policy actors, and expectant mothers?
Thank you very much. Like we said, today's World Health Day. Healthy beginnings, hopeful future. And for the health workers, you're doing all you can despite the limited resources we have at our disposals. And we want to say we see you, and you're doing good, so continue what you're doing and even do better. For policy makers, we want them to look more into maternal and child health, because that's where the beginning of society is. When you lose a mother, you lose a family, you lose a society, because mothers are very instrumental to the society. And so we want to join policy makers, our governments, institutions, to make sure they do all they can to bring about policies that can improve maternal and child health. And then for the pregnant women, you should gather education. You should know about pregnancy. You should know about the things that happen during pregnancy. You should go for antenatal care. You should not be ignorant. You should save. You have 9 whole months to prepare for delivery, and then you come to the hospital with nothing, no kobo. Like, you had 9 whole months, you understand? So that's why we are bringing out this health education. We are telling women, be empowered, be informed, because when the chips are down, you are the one on the slaughter table. And so you have to take charge of your life and make sure you make informed choices. Go for antenatal care so that they can identify problems early and and bring remedy before they go into complications. We have the trending story about a woman who just died on social media. You get
500K.
exactly, and you had 9 whole months. In this, the economy is bad, but you should do something.
You should be prepared.
Yeah, prepare, and then you should go for. I don't know. Allegedly, they said she didn't go for antenatal care, so you should go for antenatal care. That's where they will pick up high blood pressure in pregnancy. Like I said, is the number one thing killing women in pregnancy. Now that's when these are picked up early, and then this statistics gets eventually reduced. So everyone, men, you should talk to your women, talk to your mothers, your sisters. Everyone should be informed about maternal and child health, and that will go a long way to improve our health indices.